So let's talk about a very common procedure that we perform in the facility, and that's tummy tuck. What is a tummy tuck? Tummy tuck or abdominoplasty is a procedure that focuses mainly on your abdominal area. It is a procedure that corrects the muscle separation, corrects excess skin and fat, and it corrects the pubis area problem if any exists. Who is a good candidate for having a tummy tuck? A good candidate for a tummy tuck is a patient with excess skin and fat in the core and abdominal area, little to no abdominal visceral fat excess, and most of the excess skin and fat are in subcutaneous tissue with a history of previous pregnancy, and a patient that is not planning to have any more pregnancies in the future. This is an ideal candidate for having a tummy tuck. The patients also need to be close to the ideal weight and a stable weight for a minimum of 6 to 12 months. What is an ideal weight? Now, ideal weight is dependent on every single patient. Some patients, ideal weight for them are closer to BMI of 30 and less. For some patients, the ideal weight could be between 30 to 35 BMI. The lower you are to a normal BMI, which is less than 30, the better result you'll have. And the way that everybody carries the weight in the abdominal area is different. BMI, the question is BMI very important to having an abdominal surgery? Absolutely, it is important, but it is not the only indication to choose the patient for an abdominoplasty. And why is that? BMI, or body mass index, is a value that we use to assess your fat composition and to realize if you're overweight, normal weight, obese, or underweight. A normal BMI, it's anything between 20 to 25. 25 to 30 is considered overweight, and then above 30 you consider obese. So it all depends how you carry the weight. Some patients carry most of the weight in the core, in our abdominal area. So you might be a patient with a lower BMI, however, you're not a candidate for an abdominoplasty. You might be a patient with a higher BMI, but you're a good candidate for an abdominoplasty, but a bad candidate for any other procedure. Higher BMI is also associated with a higher risk for the procedure and higher duration of the surgery. What are the types of abdominoplasty or tummy tuck that exist? We do have multiple different types of abdominoplasty. The minimal, the smallest abdominoplasty possible is a mini tummy tuck. What is a mini tummy tuck? Mini tummy tuck is a small incision that still goes from the interior aspect of your hip, from hip to hip, and it only corrects the problem underneath your umbilicus. It doesn't address any problem with the upper abdominal area. It does not usually correct the diastasis rectal or separation of the muscle problem. So if you are a patient with excess skin and fat on upper abdominal area and mostly excess skin, you're not a candidate for a mini tummy tuck. What is a full tummy tuck? A full tummy tuck is a tummy tuck that goes incision from a hip, exterior aspect of the hip, to the exterior aspect of the hip, and it corrects just the abdominal area. A full tummy tuck includes liposuction of your upper abdomen, flank of pubis, which is in addition to the basic abdominoplasty. It includes the correction of your muscle separation, and it also includes a pubic lift. Oftentimes, this surgery is done under general anesthesia. It takes an average between 2 to 3 hours depending on the size of the abdomen. It can be done as outpatient or inpatient for less than 24-hour admission to the facility, and everything is done in the facility as pre-op, post-op. The next step up is an extended abdominoplasty. Extended abdominoplasty is an abdominoplasty that includes an incision that is now larger and it goes across your hip and it includes small lift of your lateral thighs. It includes your abdominoplasty, as we discussed previously. It's a good option for patients with massive weight loss that do not want to have a fleur-de-lis abdominoplasty. It also includes a liposuction that we have discussed previously, which includes liposuction of your abdomen, pubis, and flank. It always includes insertion of 2 drains. We can perform a drainless tummy tuck, however, it is associated with high risk of seroma. The last type of abdominoplasty is fleur-de-lis abdominoplasty. Fleur-de-lis abdominoplasty is an excellent option in a patient with massive weight loss over 100 to 150 pounds. It corrects the excess skin both vertically and horizontally. It's good if you have so much skin that only an abdominoplasty cannot correct it. It makes your central abdominal skin tighter. It pulls the sides more inward, but usually we don't combine that with the liposuction as it increases the risk of skin necrosis. It is done as outpatient and you will have drains post-op. What are the risks of abdominoplasty? Abdominoplasty, like any other procedure, are associated with risk and benefits. What are the risks? These risks are infection and bleeding, major infection and major bleed happening less than 1% of the time. Scarring is a major risk. Everybody will have a scar depending on your genetic and the surgeon you've chosen. You could have different types of scarring and you might need treatment to improve your scarring post-surgery. There is risk of visceral injury, which means damage to visceral tissue or damaged tissue underneath your muscle. There is risk of pulmonary embolism, which means getting a clot in your leg that could potentially go to your lung and cause respiratory compromise. There is risk of asymmetry. No matter what we do, we can never make you 100% symmetrical. And also, there is risk of chronic pain, numbness, and revision in future. No abdominal surgery or no surgery is last forever. Usually they last you between 10 to 20 years depending on your lifestyle and your life habits. Unfortunately, we all age. What is the post-op care for an abdominoplasty? Following an abdominoplasty, the complete recovery is close to 6 weeks. It takes you 6 weeks to completely recover to feel back to normal possible. If you're working from an office, it takes you 2 to 3 weeks to go back to an office job. If you're working from home, 7 to 14 days. If you're doing any sort of a core exercises such as push-ups, planks, we're looking at 3 months of complete recovery. And if you are a person such as myself, like a physician, you'll off work for minimum of 3 to 4 weeks.